This is Peggy. She's 44 years old, and we're looking to see how we can improve her appearance with the Revanesse family of products. We're going to use Kiss, we're going to use Revanesse Ultra, and we're going to use Revanesse Contour in treating Peggy and trying to improve her appearance. So what I'm going to do is I'm just going to try to find that area where there's a little deficit, and you can see it and you can also feel it. So I'll just get that ready. So here we go, 1, 2, 3, and we just go right in, and we're going to put about 0.1 or 0.2 mLs of contour. Okay, I'm just going to smooth that out a bit. And I want a little bit more. So another one, same thing. And that gives her a nice fullness in that area. It's filled up, and even the nasolabial looks a little less deep now. And there we are. We're going to put about 0.2 or 0.3 because this is fairly deep. Okay, good. So a little bit more. And you can do it superficially or you can do it deeply. I've injected both ways. Sometimes I find if you go more at a 45-degree angle, not so deeply, you can get a little bit more bang for your buck because it lifts the skin up like that. And then you can just mold that. Contour is quite moldable, and once you get it to the position you want it, it'll stay that way. The whole Revanesse family of products comes with xylocaine or lidocaine in it, so that will minimize discomfort as well. So now we're going to do the same thing here. And we're medium depth. We're not going way down. Just injecting under the skin. We want to get that fold to just lift up a little bit, just like that. And same thing here. Just like that. So less is more. We just get to the point of correction and that's it. And we're just going to do the little pout here. All we want to do is really increase that pout. We don't want to make her lip look big, huge. The trick is we want to make it just look natural, but a little more full, so that it just does that. And that'll be really a nice look, and it'll come out more to meet the upper lip, which is a little more protuberant. I go right at the margin of the lip, and then just in, right towards the middle, and then we can fill this area up. That's 0.1, and that's 0.2, and that's all I'm going to do. So we've completed the right side using a variety of Revanesse family products, including Kiss for the lips. We used about 0.2 or 0.3 ml. We used 0.4 ml for the nasolabial fold of Revanesse Ultra, and we did a cc of contour to help with her temple and her cheek areas to improve some of the contouring where this subcutaneous fat loss occurs. So we're just going to do the same thing on the other side now. And again, 0.1, 0.2, small amounts, small increments. We can always put more in later. Be careful not to go too close to the eye. You don't want to make hollows around the eyes where there's all this product and then there's like a little funny eye sitting in there. And then we're going to do the same thing here. Just as one little area of deficit, we'll just go right into it, put a little drop in. And then we just want to fix this skeletal, let me just stop that. Fix this skeletal area a little bit. It's just a little bit thin. That's great. That's filled it up a lot. So we've got that whole area as well. Hold it rather than pushing it. And a little higher. Perfect. And this side you can let go of. Great. You did great. Good. Let's just see here. I really like how that nasolabial fold came out. She got both the lift from the contour as well as the Revanesse Ultra pushing out that line a bit. I'm going to just do that lip with some Kiss. So one little tiny bit right here. Good. 0.2 ml. Good. So it's the same amount as we did on the other side. And I'll just give that a little massage. Just relax. Good. It's very nice here. There's a feathering into the normal skin. It's a little too obvious where the end is here. So I'm just going to feather that edge a little bit, right in the vermilion border, just like that. Just a little bit. Just to soften it a little bit. And we're just going to use some Revanesse Ultra to finish up this little job here. So we'll go right into the line. But this does help. If there's a definite line there that you can lift up, it really does, as you can see, it makes a difference. And I've got a bit left here, so I'm just going to actually layer it over top of the contour. So what do you do when you have a little bit left in the syringe, 0.2 ml? You can layer it on top. Just go a little more superficially. It won't do much if you put it deep, but if you put it superficially, it'll finish your job here, enhance it. You can see how this has come out now to meet the same depth as her upper lip. And let's take a look here too. And here the nasolabial fold is improved, the contour is improved, her temple is filled in again. But this is what we can do when we mix the various members of the Revanesse family for facial rejuvenation.